Okay, hello and good morning or good afternoon around the world. This is the fourth online academy webinar from 3 Dental Implants. I very welcome you. Oh, there's Dixon. Hello, Dixon. I can see you. Nice you're in. Hello. I just waited a little bit to start because I saw there's some people still missing, and they will for sure participate. And I'm not sure. I hope that it was easy to connect with the system. I just please you all during the webinar. Just put your microphone or your telephone on mute. As long as you have no questions. If you have a question, you are always pleased to just ask me in between, because yes, there's at the end of the webinar I give everybody the chance to have a discussion, but it's just easier. I don't know, right now it looks like we have a lot of participants that's coming in more and more, so please put your button on mute, and then I'm going to start. So this is me. My name is Holger Kast. I'm the implants, and my background is shortly explained. I studied dental technician in Germany long time ago, and after this time I did my social work in Germany. Then very soon I went into Switzerland to the headquarters of Straumann Implants, and at Straumann Dental Implants I was more or less responsible for in developing fields, in the prosthetic fields. I did develop a few years ago the whole bone level system at Straumann, and actually this is where I did learn a lot of knowledge about implantology. And yeah, in these 8 years, and now I'm with 3 Dental Implants about half a year long, and it's very nice to be here, and I'm very proud to do these global webinars every 2 months frequently. So the topic of today is, for those who are already familiar with 3 Dental Implants, it's about the 3 performance concept. The 3 performance concept, which you see down here, is significant, important, or the responsible part of why the 3 Dental Implant system is look like it looks, and why it works like it works. So we go into the detail of the 3 performance concepts today, and I try to explain the few points of the 3 performance concepts with also with some scientific updates, or just with some studies we made, or not we made, also other companies made, just in the implantology field. There is a lot of knowledge built the last, I would say, 40 years in dental implants, and so there's some studies made and some knowledge which made our implant look like it looks today. So this is actually the 3 Dental Implant philosophy. It is a quite important picture, or let's say it is the 5 points you see down here. This is the leading line of our implant system, and it starts with the Swiss quality, which you can see here. The Swiss quality is very important for 3 Dental Implants because, yeah, in Switzerland there's actually, I think, the childhood of dental implantology with, and there's big brands like Straumann and others which are producing their implants since years in Switzerland. So this is also something we are very proud of, that all our products are made in Switzerland and with a high quality, and actually in factories which are more than 30 years, I would say, in the implantology part. Then there's another point is the performance, and this is the point we're going into the detail right now in this webinar. And then a very important point of our implant system is the simplicity, which you all can see if you lift up our product catalog, which is a very lean product catalog, but anyways, you can find in there all parts and all products to the whole range of implantology, from a single tooth over a bridge work until teethless, edentulous products you will find in this product catalog. We have a bone level and a tissue level implant, so you have a portfolio which is maybe 50% less than in some other companies. But anyways, it gives you all products you need to do nice and aesthetically made prosthetics in the daily business. Then another big point of our philosophy is the fair pricing. We can say that we are in some cases more than 50% less with our price than other companies, and so this is it was an important point in developing and also in the way and in the philosophy of Tree. And then the different part is that we are having a lot of knowledge with colleagues. They are working in this field with us at Tree Dental Implants, and with factories we are working with. So the knowledge of the background of the system is maybe, as I told before, more than 20, 30 years of implantology, and this all packed into a little bit new way of thinking in the implantology makes a very unique and nice implant system. So let's focus on the performance concept. This maybe the similar people who know our system, they know this picture quite well. This is the performance concept. It implements 4 different gold standards in the dental implantology, in the dental industry we are working with. So the whole system is built with more or less the main gold standard, which I start from the bottom up, is the SBA surface, the bone adapts, the friction, and the soft tissue concept. And these 4 different gold standards are building our implant system. So let me start. Actually, this is Professor Marius Steigmann, and here we have Homley Wang. These 2 guys were always involved in the developing part of these 4 gold standards. It just should show you that we are working with very well-known dentists or professors in the dental field, which helped us to develop this unique and perfect system of the Tree Dental Implants. So let's start with the SBA surface. Surface is I think already one of the important things in the implant system, because with the surface you can make the implant fixed in the bone or growing, let bone cells grow onto the implant, so you have a safe and good system. So our surface is called SBA surface. That means we have a sandblasted acid-edged surface, as you know for sure from Straumann, which they have the SLA surface, which is basically the same than our SBA surface. SLA or also SBA surface means that it is a sandblasted, first sandblasted surface, so the titanium gets sandblasted, and afterwards you acid etch it, and we do this 2 times. We acid etch our surface to get the most and best deepness into the titanium to let give the cells, the osteoblast cells, the bone cells, space or a lot of surface to grow into the titanium and give us a good stability of the implant itself. So this picture is a raster microscopic picture. You can see it like this bar down here shows you it's like this line is about 20 micromillimeter wide, and it shows, I think it shows you very nicely the surface. It's made first with the sandblasting process. Like here, you see these waves, these big waves. Maybe you see the white ring here. The white ring is about 20 micrometers, and these big waves are made by the sandblasting process at first. And after the sandblasting process, we go into the deepness of the titanium in acid etching it 2 times, and then we have results like these little black dots you can see all over this picture. These little black dots show you the deepness, like deep holes, like kind of caves into the a gap size of 2 to 4 micromillimeters. So here is the first scientific study, which is made by Straumann for the SLA surface, and as I told you, it's totally the same that the SBA surface is just a naming thing, but we do exactly the same thing than the SLA surface from Straumann. So here you can see in different time frames osteoblasts growing and into the titanium surface, which is made by for example Philipp Habesetzer and Marco Wieland, which are biologics in the company of Straumann, and those they made these testings to show how nicely the bone cells can grow into a surface which is made by sandblasting and acid etching. Also, another study, as you can see here, is made. It's quite interesting. Here, it's from 2014. It's made in Sweden, and this study shows you 4 different brands like Straumann, Nobel Biocare, Astra, and also other companies where they tested for most of the time tissue level implants in the early loose, or also they tested the after 9 years the late loss of implants. And overall, you can see here the green part is 0.7% early loss of implants after a short time of the implant immersed in the patients, and also after 9 years you have only a 0.5% loss of implants with the Straumann tissue level and the SLA surface, which I already explained, which is exactly the same as the SBA surface of 3 dental implants. So to let you know that the surface is also produced in a very known company, Centre Métaux, which is based in the French part of Switzerland. Centre Métaux is a very known company. Basically, it came from the watch and jeweler industry. So they are also they are known for their metal alloys and stuff like this. So they did a lot of gold alloys, and also they are specialized in producing surfaces. So all 3 dental implants are produced, the surface of 3 dental implants, the SPA surface, is produced by Sondrometo. The machine which is testing the surfaces, and we do 100% control of our surfaces at Sondrometo. So this new machine they have there is like a digital microscope which measures at each implant the size of the preciseness of the surface before we go and clean it and package it into the boxes to sell. So then another important part is that we do with Sondrometo the surface, the sandblast process in a unique machine. So you can see here the base where we fix each implant comes on a base like this, and then it goes through a machine, and you see here it goes inside here, and then on the right side of this picture you can see the sandblasting process itself. So this machine makes sure that the sandblasting is not punctual stronger on one point than on the other point. The machine always makes sure that the sandblasting process, which is a pressure on the implant itself, is always like with the same influence on the implant itself. And herefore there's another scientific study made by an independent group of European dentists. It's called BDIZ. Is more or less every year testing different things in different implant systems. So if somebody is now in, can you please make sure that your button is on mute, please? Somebody just, maybe it's Markus Jerryman, can you see? Please put your mute button that there's no influence from outside. Wait a second, maybe I can do that for you guys. So, okay, I hope everybody can hear me still. Yes. Yep. Okay. It's good. I can only see L. Dixon, but he's smiling, so I know Indonesia can hear me. Okay, so the BDIZ Institute is not an institute, it's a group of European dentists, and they made here a testing especially with the 3 dental implant at 2015, and you can see here a microscopic picture of the screw threads, the threads of the implant outside, and you see after the processing of the SPA surface, putting the SPA surface here on yellow lines. Okay, it's German, but it's written there that that it's really positive recognized that the surface after the process of the SPA surface is very exact still. So you can see here we have still a very clean line of the threads after the producing the SPA surface. So that was another scientific study. So let's go on. Yeah. And here is another test of the company Diener, which did a picture of the Straumann SLA surface, and here on this side you see a picture of the TV41 surface, also the SPA surface, and it shows on the left side down here, green line, that Straumann has like a deepness in the surface of 2.7 micrometers, and at 3 dental implants we even have 2.6. So let's say similar results than Straumann has with the SLA surface. Okay, here just to make it clear what happens in the mouth is a 3 month follow-up results picture of Dr. Marius Steigmann. It shows nicely the functioning of the SBA surface, because you can see after 3 months the bone is nicely grown into the surface, into the SBA surface. I think this is a very impressive picture after 3 months. So here I put another picture just to make it clear what can happen. Even after a few months, the bone can grow after above an 3 dental implant. It's from Spain. It's just to show you this is something to do with having a very clean and exact function and good working surface. So here, just to let you know, on our homepage, we have always the references to our studies. So I just made a screenshot of different studies all around the world which are made for SLA or SBA surface. So if you are interested in this, you just can find the links to different things and lectures to SLA and SBA surfaces. So that was already the first point, the first gold standard of 3 dental implants in our performance concept. The second one is going to be bone adapt. The bone adapt is more or less the most important gold standard for the design of the implant. As you can see it here on this picture, here on the left side, the design itself is made by the philosophy of the bone adapt, the so-called bone adapt part. So first of all, what is important to know about bone adapt is our implant system, if it is bone level or tissue level, if it is octa or vent system, we have a conical system, so a tapered implant, which makes at the first point a bigger surface than, for example, here the Straumann 4.1 standard implant. It's shown here. It has a surface of 103 square millimeters, and due to here we have the 4.1 millimeter implant. Here we have 4.1 as well, and due to having a conical implant system, we are able to raise our surface 44% to almost 150% a square millimeter surface. So one is the surface itself, the SBA surface. The other thing is the design of the implant gives you more surface to give the bone space and chance to grow onto the surface of the implant for maximum stability. And then in the detail of the bone adapt design is basically the threads of the 3 dental implants is separated in 3 different parts. Like you see here, the lower part, which is on that slide shown black, as you can see here. The apical thread design is made with a 45 degrees thread. So you see the triangle of the threads in the first part of the first part of the implant is very radical, which gives you a self-cutting a possibility, and also gives the chance to have a nice and good primer stability after implementing the implant. And what I forgot is here the round apex part. You can see here green, so we implement this to make sure that in a sinus area the membrane is not destroyed by maybe a sharp cutting area in the base of the implant. So the middle part, it's still slightly aggressive thread, It's shown here red. It's called the body thread design, and the body thread design is 60 degrees, so not as radical as in the lower part. And 60 degrees gives still in the spongiosa, in the softer bone in the middle of the jaw. It gives still a very good primer stability, but not as strong. I mean, the thread here is not as sharpened as in the lower part. And only to give you information, in the lower part you have like a horizontal deepness of these threads of 0.5 millimeters. So it goes very deep into the bone, and in the middle part you have a deepness of the between the threads of 0.34 millimeters, and in the top part it's only 0.1 millimeters. This little triangle here, it's only 3.1 millimeter. So the crystal thread design on the top part here, it shows on the sides symmetrical lines which are parallel. So in this area you don't give the bone very hard. You don't give. Sorry, excuse me. What happened? Camera is off. Okay, my colleague just explained me that my camera is off, but I don't. Well, I see myself. I don't know. I just go on. It doesn't matter. I hope you can see the PowerPoint presentation. You can see, or?
Yes.
Al Dixon, can you see the PowerPoint presentation? Yes, okay. No, my colleague just came in and told me there would be a problem, but I think it's only the camera. Okay, back to the crystal thread design. Here, customers always tell us you have still a nicely primer stability, especially in sinus works. If you have bone only until this area, you still, because the threads go up until this groove, which you can see here, this parallel groove, that gives still a nicely good primer stability in the case of a sinus implantation. Okay, then what is also important of the bone adapt is the triple threads. We have triple threads. You can see here on the right picture. This is the bottom of the implant. So these triple threads are starting in a gap of 120 degrees. Each 120 degrees circled around the implant is starting a single thread going up here, as you can see here. And the green line, for example, is the first thread coming up, and then there's two threads in between, and the third is then the green line again, which gives a feed rate of 1.8 millimeters if you turn the implant 360 degrees into the patient's mouth or into the patient's bone. So that is, I think very good to know, because like it's almost 2 millimeters coming down into the hole, into the bone, by one circle, by one rotation, 360 degrees. So triple thread design is also implementing the bone adapt. Okay, the three bone adapt, A plus B is C, means more or less through to a strong. We want to have a strong osseointegration, and we get this strong osseointegration first of all to a tapered implant, which gives us a nice primer stability, and then the design of the thread itself gives you also a nice primer stability, and then in all, this is later also the stability of the implant due to the surface also has a higher overall stability. Okay. Then also a part of it is actually we come into another study. Here you can see the tissue level, and here on this side, right side, the tissue level implant. On the left side, you see the bone level implant, the vent implant, and the octa implant of 3 dental implants. And so here it's about the machined or the polished color of 3 vent and 3 octa implants. I wanted to show you a study of Homley Wang, which is made in beagle dogs, and it is all about the transmucosal part of of implants, where right now is a lot of discussions in the market due to the word peri-implantitis. I think it's everybody known this word peri-implantitis, and right now in the market many different customers, many different implants have a lot of difference between the design between the bone area and the mucosal area, the color, the mucosal color of the implant. And here they've made a study from Homley Wang and his group, where you can see parallel polished area, and also the design here is slightly concave. Here, and that's the same more or less, but also with the rough surface until the top. And so they tested it in beagle dogs, and the result more or less showed that the slightly concave, just go back to this area here, the slightly concave design of a polished implant in this area gives you better result due to the peri-implantitis. So after a while, you could see that in the beagle dogs, the design, this middle design, I'll just go back again, this middle design here with this cave here makes better results, that the bone stays where it has to stay, and this is where the rough surface starts. So back a slide shortly to this picture. Here we have a polished part, and then we have a concave area in the rough area of our implant system, and yes, the tissue level is slightly concave as well. Okay, then is the friction. The friction is this is wrong here. Okay, the friction is the number 3 gold standard of 3 dental implants. So friction means more or less the connection between the implant and the abutment. So all what is into the word friction of performance concept of 3 is implementing the connection, as you can see here, the connection between implant and abutment. So here is a picture where you can see more or less the screw in the middle, and then on the right side, or also here on the left side, you can see the abutment screwed into the implant. And here you have a conical area. I hope you can see all my thing here. This conical area is 45 degrees, and then we have a horizontal area of 0 degrees. So this, not as horizontal, vertical parallel area of our internal hex in the vent implant system, which implements these 2 things. So first of all, this is not about friction at this moment. This is just the configuration of the implant. We get a high stability, a good connection between abutment and implant due to a friction connection, which I'm going to explain in the next slide a bit better. The friction itself, you get a non-rotation between the abutment and the implant, which is a very big aspect for having nicely fitting implants or prosthetic at the end. And then it prevents the risk of screw loosening because you have no micro movement between abutment and implant, so the screw stays where it is. If you screw it with the right torque, then you can be sure that the screw stays and you have no screw looseness in the 3 implant system. And plus the handling is with a friction connection easier, especially in the upper jaw. So you can just stick the implant onto the abutment onto the implant, which is very nice. So the friction itself, it's different than, for example, with Zimmer. Zimmer has, I have to go back to this picture, this cylindrical part down here in the internal hex is, for example, at a Zimmer implant system, it's slightly conical. So you have a 1 degree conical area in the internal hex, and that's how the Zimmer connection gets their friction. But this is, I would say, a little bit older technique than we do it. We have, like in a microscopic picture of an abutment, which is slightly old picture, but I think it explains it. We have this area of the hexagon, which you can see here. And then if you zoom into these 2 areas, zoom into it, then you are at this picture, and there we just, at the manufacturing of the abutment, we just cut a little bit out of 1 corner here, of 1 corner of the internal hex. We go out in a radius of 1 degree, and so this gives a little over conturation in the top part. In this part, as you can see here, in this part of the internal hex, which gives you then this friction connection. And yes, just to explain you again, the friction connection is very good to have no screw looseness. Since 3 is on the market, I never get as long as I do it, it's only half a year, but also my colleagues, which are longer in the company, tell me that there is no problem with screw looseness, which is a big issue for a lot of implant systems. So with the friction connection shown on this picture again, we really prevent for screw looseness. Internal connection 45 degrees gives you a nicely closing up for having a very connective connection between abutment and implant. And here in the cylindrical part, on top here between these red rings, we have the friction connection only slightly on top here, and the rest of the implant is cylindrical, symmetrical, different than, for example, the Zimmer connection. Also to the friction, you will find different scientific summaries and studies on our homepage. I don't have to go deeper into this. If you are interested in this, you always can call me, or also Sandro Venanzoni, our developer, head of developing in 3 dental implants, for getting more information or more studies into the detail. Okay, then we are already on the 4th gold standard of the 3D performance concept, the soft tissue concept. And I think this soft tissue concept is one of the biggest invention of 3D, because it shows really, first of all, the simplicity, and also the way that we are working with the newest standards of implantology. So the soft tissue concept basically is all around this area. This area is in the tissue area, so you see here the bone line, more or less here, of a bone level implant, and the outcoming of the abutment, the soft tissue concept is always concave, like in this area. So it's always concave, always means it's from the healing color to the impression components, all over to the abutments until the final crown. You have the same outcoming of the tissue area of the abutments. This area. So the background of this is also here shown in a study, which is made a few years ago, now 2014 actually. It's about the tissue thickness combining with also peri-implantitis or also with implants with platform switching, because the platform switching system is a little bit similar to the soft tissue concept of 3 dental implants, but here the soft tissue concept itself, is in 3 dental implants, it doesn't implement the platform switching, which 3 dental implant has as well. But here in this study, there's made they had 80 different patients, 38 male and 42 female patients, and they separate them in 2 different groups, like in a group with a thick gingiva, like more than 2 millimeters thickness above the bone level, and a group which had less than 2 millimeters until lower than 1 millimeter tissue level height or above the bone level. And so then each of these 80 persons got a bone level implant with platform switching. And after a while, they tested differently the peri-implantitis or the shrinking of the bone around the bone level, due to the tissue. And significant. So the conclusion here, you can see the conclusion of it, showed that the group with the second group with the thicker bone, with the thicker tissue, not with the thicker bones, excuse me, only with the thicker tissue above the bone level, showed significant better results due to the resorption of the bone. So this scientific testing or is showing that it's essentially important to have a healthy and thick tissue surrounding the implants or also the abutments. So on that slide, you can see the abutment design. Actually, I told you I did develop the Straumann bone level, and at this time we developed at Straumann, we developed all the design, as you can see here on the left side, convex, in a convex direction, and but the tissue level, which you can see the soft tissue management on 3, which you can see here on the right side, is concave. So here, this philosophy of this convex area is not longer, in my point of view, not longer relevant, because the tissue, the soft tissue concept has a very nice feature, and this is, as you can see on this X-ray, you get in horizontal area, you get really thick tissue, and this surrounding around the implant in the dangerous area of peri-implantitis, of the biologic threat, we can make sure with the design of the soft tissue concept, we can make sure that the bone is nicely covered with tissue above the bone level. So that made actually with Mario Steigmann in the beginning of this tissue concept at 3 dental implants. This is the background of this concave outcoming of all the abutments. And as I told you, it is all from the gingiva forma to the impression taking components. We follow this design soft tissue management to make sure that also in the time of taking the impression, for example, we don't stress the gingiva, because the newest results of scientific testings show that stressing the gingiva, or also not only stressing, just giving the gingiva gingiva not enough space to grow around and cover the bone, protect the bone, is a significant difference showing to shrinking the bone around like the peri-implantatis area. So with the soft tissue concept, we make sure that this is not happening. Okay, here soft tissue concept picture of Dr. Antonio Armijo. Dr. Antonio Armijo is from Spain, and he just actually put this picture a few days before in our Facebook site, and I think this is very impressive, showing the space you can make with this soft tissue concept, the horizontal space which we can give the gingiva to cover the bone and protect the bone from shrinking. Okay, there is another picture of a one-year follow-up from Dr. Mario Steigmann, also very impressive. It's already 1 year in there, and if you look directly, you even can see growing the bone into this soft tissue concept here a little bit. On this side, it's just where it has to be or where it could be at the starting of the SBA surface. Another, I think, very impressive picture to show the concept of the performance concept actually of the 3 dental implant system. Yeah, this already was the 4 points, the 4 gold standards of 3 with the performance concept. Again, just to repeat it, is the SBA surface, the bone adapt, the friction, and the soft tissue concept, which makes this implant system to a unique, functional, and high aesthetical implant system. And then there is something else. There's another scientific update I want to give you about the 3 octa with the pink implant neck. And not only the 3 octa has the pink, I'm going to show you, but yeah, as you know, this pink area of the 3 octa implant is first of all, the 3 octa implant is the same design, from the same bone adapt design as the vent implant, as the tissue, as the bone level implant of 3 dental implants. And so this is showing another time the simplicity of the system. Here you can do a bone and a tissue level implant system with one surgical kit. So we only use one surgical kit, one drill for bone level, as you can see here, and tissue level. Yeah, as I just said, it's the same drills for both systems. And then we have the pink anodized implant neck for better translucence, which I'm going to show you now. Again, here the 2 implants. Here you can see a Straumann situation with a very thin tissue, and this is the problem of the gray shining of the titanium. If you have a tissue level implant, it can shine through the gingiva, as you can see nicely here on that picture. Then on a case with 3 dental implants from Mr. Tuffert, with Dr. Tuffert. Here is the situation. He implements on the left side, he implements 3 dental implants, and you can see above here there's Straumann. And also on the right side, he put some Straumann implants, and that's the next picture. This is the tissue level implant, the 3 octa. And the 3 octa nicely shows the pink color, here, and also I think it's an impressive picture because you can see the blood nicely coming up the SBA surface of the octa implant. And then, as I told you, on the left side he has octa, on the right side he has also octa, but from Straumann. Here you see the X-ray. And that's a prosthetic, which I think is very nice, aesthetically made. And the aesthetic result from above, both sides are more or less similar. And here just a picture of the gingiva line, as you can see it down with the 3 octa with the pink neck, and the titanium neck of a Straumann standard implant. You can see slightly this grayish gingiva shining through. Okay, and there is also the last scientific update I want to give you in this webinar, and this is something we are very proud of, because this is made in the University of Zurich, and it's maybe only 2 months out now. This is this picture, or this test was made with in the University of Zurich, as I told you, and what they did is they measured also with a very thin gingiva, above 1 millimeter thickness in horizontal way. They put they measured the color, the color shining through this gingiva, and as you can see here, we have titanium. And then they measured the color shining through with a titanium anodized gold tissue area. And then there is our 3 pink implant, the Octa implant, and here is zirconium, and the results are really significant. As you can see here, the results with a pink anodized implant is almost the same than with if you would have a white zirconium full ceramic implant. So that made us really proud to present this independent study.
شكرا لاستخدامكم شبكة زين. يرجى الانتظار. المشترك مشغول حاليا بمكالمة أخرى.
I don't know what this is. Well, it's I didn't understand the language, but okay, it's yeah, we are back. So we have a significant better aesthetical result, like 46% here, better than a titanium colored tissue area, or also if it's anodized in golden, you won't get these results, which are almost similar than zirconium. And last but not least, as you can see on these 2 pictures already, this is the Octa implant, and here you see the bone level implant with an anodized abutment, which I put on this slide again. Here also for the bone level implants, because the bone level implants, as the name says, is it ends on the bone level, and in all the tissue area, which you can see this abutment is our contour aesthetical abutment. You can see we anodized them also in the same pink color. So this area down here mainly stays in the tissue, and so it gives you also the same aesthetical results than if you have a tissue level Octa implant in the tissue. So if you teach a dental technician to only mill in this area and keep the hands off this area down here, if it's possible, then you get the same aesthetical results than with the Octa implant. Okay, just to make another time clear, this anodizing process of Octa implants and the aesthetical lines of our abutments in our portfolio, the anodizing process is nothing else than getting the oxides of the titanium on the surface. And this is a process which happens in all titanium, in all materials and in all metals. Actually, it happens due to the oxides, on the surface. It comes that the surface gets the oxides very fast, especially with titanium. So what we do here, we just do this bath in electronics bath, and we put more oxides on the surface, as you can see here. If you make like the thickness of the surface with the oxides wider or less, then you get different color codings of the anodizing process, and this is what we perfectionized in finding exactly the pink color in this area, which gives us this nice feature. So just to let you know, the difference is it is actually completely the same if you have a machined surface of a titanium implant, or if you have a machined surface plus anodized surface. There is no difference for the bone cells or for anything in the mouth area. Okay, then just to give you an overview of, because this is a question I got the last weeks a few times. This is a slide I just made to make sure that the pre-performance concept, all the abutments, which you can see here, first the drilling in the implant, we recommend not to go over 40 Newton centimeters during drilling the implant into the patient's mouth. Then, if you have a gingiva former to implement in patient's mouth, just hand screw it, or maximum with 15 Newton centimeters in the patient's mouth. Then over here we have screw retained restorations. So the abutment underneath the screw retention is about 30 Newton centimeters, and above the prosthetic part is with 20 Newton centimeters for in the patient's mouth. Okay, and then that's almost the whole show. I give you a short update of the Tree Academy, and then we have the discussion round, if you like. So the Tree Academy is what we just had in the virtual world. Just to make clear, the Tree Academy is more or less our studying and our webinars and trainings we do all over the world. It's made in three different lines: in online webinars, in on-site trainings, in local trainings. So what it means is we try to offer our customers the biggest chance to make studies. And for example, on the 27th of January is the next 2 monthly online webinar, which we just had now. It will be the first time with an external dentist, and the topic is not 100% clear, but I think I would like to have the dentist showing a lot of cases, and that we have maybe an interactive discussion in this next webinar. But I'm going to inform you in the earliest time about the new online webinar taking place 27th of January. Then there's always the possibility to do on-site trainings. So we have, as I told in the beginning of this discussion of this webinar, we have a lot of new customers all around the world these days, and so there's always the possibility to set up a meeting where we have like a 2-day course in Switzerland, where you can see the production of our Tree Dental implant, and also you can see the Tree Academy, which is here, the room where we can teach also our customers and employees. And then the other thing is the local training. Our training group is always possible to come into your country and set up a teaching or a course in your country. We just have to contact us, and then we can make sure that we will arrange a nice setup and a nice training. Okay, then a big reminder on our first World Congress in Istanbul, which takes place May 5th to 7th in 2016. As you can see down here, I don't want to name all these very known speakers, world-class speakers. We are really proud to invite you all to or share a good time in Istanbul with a lot of nice speakers. Plus, also the surrounding of Istanbul is amazing. I just have been there to do a course 2 weeks ago, and Istanbul is a beautiful place to be. And besides that, we offer you, Tree Dental Implants offers you a very nice congress, a 2-day congress. Please join us on May 5th to 7th, 2016. Then another wish from us, because the virtual world is going bigger and bigger. We have our Facebook sites. Now there are several different countries have their own Facebook connections already, but you are all invited to get friends and like us on the World Wide Web on Facebook, where we, as you can see here, where we announce our things which have been or which are coming every day almost. So you are always updated of 3 dental implants if you are being a friend or like our homepage on Facebook. This is, for example, the last course in Turkey. Okay, then I would say I open a discussion, and thank you all for listening. Please just give me a feedback or just start your questions about the 3 performance concept. Still somebody there?
Yeah, Holger. Thank you for your nice explanation. I think it was very clear from my point of view. I have only one question about the recommendation of the speed from the drills when you place an implant. What's your recommendation then?
Okay, actually, I think there is just made these days a new, we are just working on a new slide to give you, because that's why I put this one slide with the Newton centimeters, and I think we built this new slide, and I would like to give you this slide in the next days. I'm just working on it with Sandro, and we have a little discussion what is the official recommendation we're going to give you, and I just would write down these questions of you and give you this answer, the correct answer, with a slide you can use for this question in future in your market. Is that okay?
Okay, perfect. Thank you very much.
I write it down, Frank. Okay. Okay. More questions, please.
No questions.
No questions? Dixon, you're smiling. I only see you online. Not online, but on with the camera.
And I'm just thinking how to explain it in English.
Well, you can do it.
No, I have a couple of requests from our customers.
Okay.
About 3 study cases.
Okay.
Yeah.
So
because,
maybe if you don't want to ask it now, just make me a question email, and I'm going to answer afterwards if it's better for you.
Of course. Okay. Sure. Thank you.
You're welcome. So, are there more questions?
No.
Okay, then I would say thank you again for listening, and I hope next time when we have an external speaker, we have more participants of this show, and I wish you all a good rest of the week, and be happy and in peace in these times. This is maybe very important too, and good sales on 3 dental implants, and we are always there. If you have questions, please contact us. Yeah, thank you very much.
Thank you.
Thank you, Holger.
Bye-bye.
Holger?
Bye.
Hello?
Hello? Yes?
Hi, Mr. Holger. How are you?
I'm fine.
Hello?
Who I'm speaking with right now? Ashraf.
Yes,
Hello, Ashraf.
This is Ashraf Hanoun from TRI Jordan.
Yes, hello. How are you, Ashraf?
I'm fine, thank you. Thank you for this nice lecture. Actually, some of our colleagues cannot deal with the new system of webinar in Jordan here. Some problem in the internet, maybe.
Oh,
So,
that's sad. Actually, right now, yeah, we had like lots of people connected. So maybe we can also do this in another testing. Maybe we can set up a time where we try it together to solve this problem. I think you got the step-by-step documentation how to do it, huh?
Yes, I'm joining you since you start 10 minutes after you have started the webinar. I am hearing you very well, but sometimes the picture go on and off. But I am hearing every word of the lecture. It was nice. I have some colleagues. I have some dentists with me from Jordan. They are joining. I don't know. Did you have the number, or did you get anybody from Jordan?
Yes, the problem was this is something I really have to find out as well. This is always a little bit hard for me if I'm having to speak and also test who is in the conference. It's a little bit a lot, so I don't know exactly. I cannot tell you who all were in the meeting.
The number. Okay, so also the movement of the slide, we have a little bit problem. Sometimes it's paused. We have to tap before we can zoom in or out.
Okay.
So
yes. Okay. I mean, it's always depending on the internet line, how fast the internet line will be. So if you have a poor line, it's not that easy. Actually, I think L. Dixon, are you still in there? How was it for you? Because he's in Indonesia. And
it's really good here. I can see.
Okay, you have a very good connection?
Yes.
Okay.
Yes. I think the problem is we have to set a meeting next webinar, in an area where is a Wi-Fi, direct Wi-Fi, in a restaurant or in a place in the company center. I mean offices. So we have a good line, a good internet line. It will be much better than using because most of the doctors are using their iPhones. You see?
Yeah. I think this is very important to make sure you have a good line, because it's not easy to find the right tool to do these webinars, and that's why we choose the tool where we have the audio line through telephone also, so we can make sure that the audio is the best result we can get. And I just see that Belinda from Australia. Belinda, how is the connection for you from Australia? Or is this Belinda from Australia?
She's on mute, I think.
Hello?
She's on mute, yes. She's. Okay. So yeah, this is a technical thing we are working on. That's why we changed actually to WebEx, because we think it's the better solution. And yes, I have to talk to our IT department if we can do something. But just for the next time, make sure you have a very good internet line, as we can see with L. Dixon. He's in Indonesia, which is quite far away from my home, and he had a perfect line. So maybe just make sure that the connection is good.
Yes. We have a good voice. The voice is very clear, actually.
Okay.
It's a very nice voice, the voice line. But I mean the audio visual. I think the visual line is a problem. No problem, but it was very clear. Some slides, the slide was paused a little bit, but I can hear you very clearly. And it was very nice. Maybe around, I have maybe 49 from Jordan who try to connect. Yani at least, hopefully, I have 20 dentists, please. If not more.
I hope, because I could not see who was all connected. There were, I was wondering, I missed a few people, and actually, yes, maybe it is, I'm not sure, I just say it, maybe it's also a reason of our political situation. Could be a reason as well, I'm not sure, but
Yes.
we don't know.
Maybe.
Yeah.
Okay. Thank you
Okay.
very much. Appreciating
Okay.
your lecture.
Yes.
Okay, I have a short question for you.
Yes.
It's about the surgical kit rubbers. Any
Yes.
updates?
Any what?
Updates, because the rubbers on our kit is all destroyed.
So I'm going to send you rubbers, and plus there is an update. Yes, we're going to have the tools, the new tools, but not a new. Yeah, there's coming some news in the early future. Really, as soon as possible, we know about this rubber issue, but we're going to give you therefore as soon as possible feedback, or not feedback, but as I know you now that the rubbers are all gone, we have to send you some new ones. Okay.
No, but the problem is, Holger, with the rubbers, it's really hard for the dentist to use the ratchet.
Yes.
Or the kit, it's really hard to put in the drivers to the ratchet.
I know. It's
how to...
it's something I can say. We are working on that, and we are shortly before delivering you the new technique of doing it. So it does not take too long time, and we will have it differently. So this problem is a problem we will solve very soon.
Okay. Excellent.
Okay.
Okay, thank you very much, Holger.
You're welcome. So I'm going to close this group then, yes?
Okay.
Thank you very much for listening.
All the best.
All the best. Bye.